Is COVID-19 the great equalizer, killing off people worldwide indiscriminately, or does it demonstrate the socioeconomic and racial divide we have in healthcare in America? We have two related and complex issues: poverty and race. First, in 2012, 46% of adults ages 19 through 64 were uninsured. Obamacare reduced that rate to 24%. Before COVID-19, changes in healthcare policy under President Trump, 44 million Americans were uninsured. Before the pandemic, 66.5% of bankruptcies were due to medical bills. That's 530,000 American households. 47 million people are losing their jobs due to the coronavirus and their employment-based health insurance. In total, that is 91 million people without insurance. This does not include the underinsured, those where 10% of their income is going towards medical bills. Let's hear what Bernie Sanders has to say.
This current horrific crisis that we are now in has exposed for all to see how absurd our current employer-based health insurance system is. The current economic downturn we are experiencing has not only led to a massive loss of jobs, but has also resulted in millions of Americans losing their health insurance. While Americans have been told over and over again how wonderful our employer-based private insurance system is, those claims sound very hollow today as a growing number of unemployed workers struggle with how they can afford to go to the doctor or not go bankrupt with a huge hospital bill.
Demographics of the uninsured. Looking at the demographics, half of the nation's uninsured are from minority communities, while 21% of Blacks are living in poverty and 18% of Hispanic or Latinos. So, are some races or ethnicities more susceptible to COVID-19 than others? Well, here's what we know. Risk factors or underlying conditions that put people at risk for COVID-19 are respiratory conditions such as asthma, and African Americans are 20% more likely to have asthma and 3 times more likely to die from asthma. Heart disease. Black Americans have higher rates of death from heart disease than other racial groups. Heart disease for whites has been decreasing while remaining stable for other groups. Hypertension or high blood pressure. Black Americans have higher rates of high blood pressure than other groups. Obesity is another COVID-19 risk factor. Blacks and Hispanics have higher rates of obesity than other Americans. Diabetes. Hispanics, followed closely by Blacks, are prone to diabetes. High cholesterol is pretty much on par for all racial groups. And this statement was given by the International Indigenous Youth Council. When you talk about high rates of COVID-19 deaths in Black, Brown, and Indigenous people of color communities, do not mention diabetes, high blood pressure, and asthma without also mentioning the poverty, redlining, gentrification, food deserts, healthcare disparities, environmental and systematic institutional racism that leads to those underlying conditions. So, who is getting sick and how sick are they getting? Let's listen to Congresswoman Alexandria Ocasio-Cortez.
Welcome back, Congresswoman. Thanks for coming to talk to us.
Thank you.
You represent the district. Oh, you're welcome. You represent the District of New York City that encompasses parts of Queens, the Bronx, and has become the single hardest hit congressional district in the nation. It's an area that is heavily minority immigrants, working class, and working poor. So how much clearer does it have to be in the country that this pandemic, while treating us all equally, killing us as it kills us, But why isn't there more emphasis on what's happening to poor people in this country?
Of course. Well, I think sometimes when a pandemic like this hits, or even any natural disaster like a hurricane, like what we saw in Hurricane Katrina or Hurricane Maria, they don't happen in a vacuum. They happen in a social and historical context. And when communities have already been made vulnerable by mass incarceration, when these things happen in the context of redlining, in wealth inequality, in a racial wealth gap, what it does is that it impacts the most vulnerable the most. And my congressional district, New York 14, out of the top 10 most impacted zip codes in America, 5 of them are in my congressional district, including the top 3. And what we're seeing is that the communities that are most impacted across the country are overwhelmingly working class, Black, and brown. In Chicago alone, 70% of the mortality are Black Americans. And it just goes to show that these things do not happen in a vacuum. They happen when communities are disproportionately on the front line. Here in New York City, about 65% of our frontline workers, including grocery store workers, delivery workers, and more, are Black and brown. They're Black and Latino, and they're non-white, and they're working class, and they're being paid $10-15 an hour. They don't have health care. And so when your family is ravaged by a pandemic, you can't see a doctor. You're already your family's already operating in the context of public policies that don't really see the reality that our families are confronting. And so, it's tragic, but it's also no surprise that it's impacting the vulnerable the most.
Congresswoman, the Surgeon General suggested last week that African Americans and Latinos should step up and stop behaviors like drinking and smoking to help curb the spread of coronavirus in their communities. And I thought his comments reinforced the notion that personal responsibility is to blame for the racial health disparity rather than systemic racism. What did you make of that?
I completely agree. It's so funny how this pandemic was, when it was impacting the elderly, when it was impacting all sorts of people, we didn't talk about personal responsibility. We only started talking about taking personal responsibility over contracting coronavirus when we started talking about Black Americans contracting it at a higher rate. Obviously, there are certain things we can do to make sure that pre-existing conditions don't exist, but ultimately, it's inequity that's the pre-existing condition. It's the inequality that's a pre-existing condition. And you can't just go to someone and tell them, hey, you should have had health care this whole time when you're working, an hourly job and your employer doesn't give it to you. A lot of these pre-existing conditions have to do with the inability to access quality health care, the inability to afford quality health care, because we live in a country that continues to have a for-profit healthcare system, unlike the rest of the developed world. And on top of that, the Bronx, we have a mortality rate that is twice. We have a coronavirus mortality rate that is twice the level of the rest of New York City. It's not a coincidence? The fact that the Bronx has one of the highest asthma rates in the United States. And a lot of that has to do with environmental inequities that oftentimes, just look at Flint, just look at Baltimore, just look at the Bronx, that public policy has polluted these communities, has poisoned the air and poisoned our water. And that is what is creating the large-scale pre-existing conditions that are making our communities much more vulnerable than others. And so while, yes, if you're smoking, you should consider to stop, and that goes for everybody, at the end of the day, that's not why there is such a high incidence of coronavirus that is impacting these communities disproportionately. It is systemic inequality, and we have to take responsibility for those inequities, and we have to make sure that we respond to it not with a personal choice, but with public policy.
The New Yorker is calling the coronavirus, they're now calling it the Black Plague. They just named it that on April 16th. The data tracked that we're using to track this is through zip codes, and it found that people in predominantly Black neighborhoods were far less likely to be tested, far more likely to contract COVID-19, had more severe cases, and were more likely to die.
Look at this chart. You can see African Americans represent 41% of COVID-19 deaths. The next closest race, Caucasian at 28%. We want to bring in Dr. Frank McGeorge. And Frank, I've said this all along, that's a significant difference.
Yeah, it sure is. And it's a trend being seen around the country as many states and regions are breaking down the numbers by race. No doubt the COVID-19 pandemic has affected African Americans very differently than other races, and the reasons need to be investigated. Whether you're talking about Michigan, where 33% of cases but 40% of deaths have occurred in African Americans, or Illinois, where 29% of cases but 42% of deaths were in blacks, COVID-19 is causing a higher rate of deaths in African Americans. In Louisiana, 70% of people killed by COVID-19 are black, even though they only represent 32% of the state's population. Now, the reason for this needs more analysis, but we do know, overall, African Americans are more likely to suffer from high blood pressure and diabetes. Both are risk factors that have been identified in other countries for developing more severe disease in COVID-19. Now, many speculate that the COVID-19 pandemic is helping to uncover health disparities that have long existed in America. Another avenue being investigated is whether there could be genetic and physiologic factors that could make certain races more susceptible to SARS-CoV-2. Everything from different numbers and types of certain receptors to the way different races might respond to the massive inflammation induced as COVID-19 worsens are being looked at. Now, I realize it's really tempting to simply jump to the conclusion that the mortality differences that we're seeing in African Americans is simply due to healthcare disparities. But it is just as important to sort out any other potential contributing causes so we can figure out if there may be a more specific way to correct the problem. There's little doubt that underlying illness plays an important role here, but there may be much more beneath the surface. Back to you.
Yeah, okay. Frank, thanks.
Okay, looking at this chart, you'll see that the chart on the left shows states with the highest Black populations and the percentage of population who are Black in those states. And you will also notice the percentage of Black COVID-19 deaths. The bar graph on the right are essential workers. And it's the number of Black essential workers compared with the share of total workers, putting them in higher jeopardy of contracting COVID-19. There's also been a lot of misinformation about COVID-19. At first, in February, there was a rumor going around that Black people could not get coronavirus. This is a myth. Black people certainly can contract COVID-19, as we've seen, and they are dying. Another myth is that only older people could get it. Again, not true. We've had deaths as young as 6 weeks old, all the way through to the elderly. Another piece of misinformation was that at first they were telling us that you shouldn't wear a mask or rubber gloves. And now they're saying that you should. In fact, in North Carolina, the governor just recently passed that you have to wear a mask when you're going to the grocery store. But many Black men in particular are afraid to wear masks in stores. And here's why.
Here's how you can make your own face covering in a few easy steps.
some of the historical stereotypes about blacks, particularly black men, is related to criminality, is related to strength and physicality, and these are stereotypes to supposedly be scared of. So when people interact with people across racial divides, oftentimes they're not as familiar. And part of what that means is that historical stereotypes about race come to light. So when they see black men exhibiting a particular script, in this case, wearing a mask in a store, what it signals to people is that they are trying to rob the store, instead of realizing that we are in a moment where people should be wearing masks. They actually should be rewarded and applauded for that. When black men are getting ready to go out to a store to get essential goods for themselves and their families, they have to think and actually go through what I call a signaling process to try to think about what are better ways that I can signal to people that I'm not a criminal, that instead I'm someone who's wearing a mask to protect myself and to protect other people. Let's take a middle-class black man who has a college degree, has a professional job, and say he simply wants to go to exercise in his neighborhood. They might be predominantly white. Well, he's going to go through a signaling process. He's going to engage in certain types of behaviors. He might wear an alumni t-shirt from the university that he went to, the signal that he graduated from college or attended college. He's going to probably always have his ID on him. He's going to probably run in well-lit places. When he sees neighbors, he's going to be more likely to wave at them and smile at them. And we have to think about this. It's not saying that people can't be friendly. I'm from the South. People smile and say hello all the time, unlike they might do in other parts of the country. But it's an extra level of baggage they have to do, because what they're trying to do is signal that I'm safe. This has transference across the socioeconomic status. And of course, black women are not immune to it as well. So for black people, when they go out in public, it's an additional layer on top of having to think about their health and safety. I think when it comes to keeping black Americans safe right now, I think one of the biggest things that can happen is that the federal government, as they continue to enact policies, stimulus packages as it relates to COVID-19, one that they really need to implement. And this not only will help Black Americans, but everyone as well, in particular Asian Americans who are also experiencing high levels of hate crimes right now. They can actually strengthen hate crime laws.
Stay home. Stay home. That's what they tell us. Staying home is a privilege that many do not have. It's a luxury. And flatten the curve. How many people really understood what that means, to flatten the curve? For some people, this is home. They tell us work from home, submit your assignments from home, have your schooling at home, do it all online. But for many people, this is the reality. And then you have the number of students who don't even have a home. 17,876 students are homeless in America. And I think that's actually a pretty conservative estimate. I worked in a school in Durham, North Carolina, where we had 200 homeless students that we knew of just in that school. Taking a look quickly at the timeline, the government may have known as early as November about this unknown virus or a type of coronavirus. December 31st is when we got word about the epidemic of pneumonia cases from China. The president was sent a memo in early January that he claims he never read. On January 7th, the outbreak was officially identified as a new coronavirus called COVID-19. January 21st, the United States announces that it has the first confirmed coronavirus case, a man in his 30s in the state of Washington. On January 31st, the president announces that there'll be no foreign travel to or from China by foreign nationals. And on February 8th, we have the first COVID-19 death of a U.S. citizen. California is the first state to have a statewide shelter-in-place order, and they don't do that until March 19th. The month of February is largely ignored, and the president was in a state of denial, often comparing it to a strain of the flu. So Trump says that nobody really knew what a pandemic was, or that it was coming. But his advisors apparently had told him as early as as
be a
early
pandemic
January.
or an epidemic of this proportion?
There may and likely will come a time in which we have both an airborne disease that is deadly. And in order for us to deal with that effectively, we have to put in place an infrastructure, not just here at home, but globally, that allows us to see it quickly, isolate it quickly, respond to it quickly. So that if and when a new strain of flu, like the Spanish flu, crops up 5 years from now or a decade from now, we've made the investment and we're further along to be able to catch it. It is a smart investment for us to make. It's not just insurance, it is knowing that down the road we're going to continue to have problems like this, particularly in a globalized world.
This was the number of cases that we had worldwide as of April 18th. There were over 2 million confirmed cases and over 160,000 deaths. So is COVID-19 the great equalizer, killing indiscriminately? Maybe. But I think I've proven here and exposed that there are many inequities in our current healthcare system. So now the question is, what are we going to do about it?